All right. So looking at level two A and B, we're just going to cover a few things in this um, lecture to make sure we're all up to speed. This is posted in your modules. So what is level two field work? Well, it's where you'll be assigned the two full-time placements. They're 8 weeks each. An affiliation site, we assume, will be 40 hours per week, but it is what is the full-time equivalent at each location. So if your therapist is only working 35 hours a week and that's their full-time, that is fine. If it ends up being less than that, I need you to let me know because we may need to add in something else. So, and you will be under the supervision at this time of an OTR or a CODA. It no longer works for you to be under someone with just a professional license. They also must have been out for at least 1 year. So if they graduated in August but didn't license until November or December, that's not good enough. They have to be practicing for at least 1 year. And so we generally, want to make sure that you get to different sites and it has to be done so you get the best overall education that you can. And so what's our goal? To develop those competent entry level generalist OT assistants. And so we're not looking for you to be, a specialist by any means, but we want enough that whenever you graduate, you feel good that you can go out and be CODA in that particular setting. So, looking through some of the requirements here is in all settings as before, we want to make sure and look at those psychosocial factors, and you will have a weekly planning form. You'll also have a weekly discussion board where you make sure that you achieve that goal as well and that we don't forget that. There should be adequate staff to supervise you. You shouldn't go in and have 10 other students. If that's the case, I need to know. If it's adequately addressed, well, then we can work it out. But if it's not, that's something I need to know. So looking at 16 weeks, total 2 sets of 8 weeks is desirable. Supervision in general, it should be pretty close supervision at first. So direct care, direct means line of sight. It doesn't have to be, but that's preferred. And then gradually decrease to less direct supervision, meaning they're in the building, you're on floor two, they're on floor four, but you have a way to contact them. And that's ultimately the goal, is for you to operate as a functioning COTA. Um, so moving on, this is very important. This is what you need to understand. How in the world do I pass? So this is a pass-fail course of 6 credit hours. You do have to pay tuition because you're earning those hours as well. And so what must you achieve? There's a total of 124 points possible. And in order to pass, you have to get 91 of those. But very important on the numbers 1, 2, and 3, those are about safety, ethics, and understanding, regulations and documents. You have to get at least a 3 on your final. If you get a 2, at your midterm, that's okay. I'm going to ask your supervisor if there's any qualms or concerns at all about you not making a 3 on your final. I'll take care of that and ask those questions. So on the midterm form, there's not a pass fail. They will do a midterm on you from the AOTA for work performance evaluation. If you're in the 45s, 50s, we might be a little bit concerned. We might want to make sure that we look and address the things that you're missing. But trust me, you may get a 60 out of 124, and we know that that's a 50% or less in a class type setting. That's totally okay at midterm. That is not okay at the final. Whenever you pass your certification exam, it has to be within a 75%, and that's what the 91 is as well by the time you're done. As far as evaluations, I will send out a sign up list and I'll give you days and times that I'm available, and you and your supervisor will meet. And I will either do a Zoom session with you and your supervisor, and you should have this AOTA Fieldwork Performance midterm uh, complete. There'll also be another form that I show you. It's a little summary. That's what we'll really cover. Make sure you've done both of those things before we meet. If there's any concerns at all, I'm going to point those out and make sure that we're addressing whatever we need in order for you to be successful in your field work. Prior to that time, if we get to week 3 and things just seem a little bit off for whatever reason, I'm going to expect a phone call from you. Also, we'll be doing a weekly planning form where you tell it's time to sell yourself. So you're going to put down, things that you did well this week, things you need to work on. They'll do the same. And then you'll set your goals for the next week. I read every single one of those. If at any time I'm a little concerned about what they're saying, I'm going to leave you a note in the comment box and say, pay attention to the second thing they said. Pay attention to the fourth thing they said. What are you doing to improve that? So I'm constantly looking and watching over you guys. If at any time you have any questions or concerns, you will call me and we will work it out together. So this goes through and tells you about that weekly planning form, and it's in the student resource section. Everything I say is in print and written. And so even if you don't remember a word I said, it's all in your Fieldwork manual, which is located under modules. All right. So what are the objectives? And these are set forth through AOTA. We are an accredited body. We make sure we follow what they want. And so the first thing is that we're consistently adhering to that AOTA code of ethics and their safety regulations, using that sound judgment in regard to safety and others. We want to demonstrate adherence to the basic tenets of OT. We want to develop those entry-level skills that we've been working on all year. And we want to kind of hone in and really, really make those shine. We want to be able to monitor, reassess. We're going to use the OT process. That should be second day's news by now for sure. And we want to do things that are client-centered and occupation-based. We will implement those evidence-based and occupation-based interventions effectively. We're going to tell the families what we're doing when it's necessary, especially when older people have families involved, if they're there, and definitely in the pediatric setting. We want to tell them what they did well on and what they didn't and how they can help us. Know that sometimes parents may just be doggone tired, and that don't take that as a brush off. Take that as a fact of they have that child the other 23 hours out of the day. So show them some respect and help them to understand things that they can do that can make their life easier. As far as behaving all times during the clinical experience. And so I really don't care for, the term of, constructive criticism. I really like it to be, constructive in a positive manner. I'm going to give you this input to help you be better. This is the time that we really want to watch giving excuses. And what does an excuse look like? Well, I know with me, if somebody says I'm not doing something right, I want to instantly tell them why I did what I did. Hold up just a minute before you do that. And instead, listen to what they say, take responsibility for whatever actions that you had with it, and say, I was thinking about this. What do you think about this? Rather than just trying to interrupt and try to get your words in. Instead, they are the professional. And if they say they want to see something improve, well, then we're going to improve it. And so that may be professional work behaviors. Maybe you're having trouble getting to work on time. And your affective skills. And we know this, we've talked about this all year long. It's the soft skills from the affective skills PowerPoint, that communication. What does your face look like whenever you are, discussing things with the parents? If you're discussing them with your supervisor and as well as other employees, those things are noted. You want to make sure and have that cultural awareness in diverse populations. The other thing is, as far as recording, we have to watch that now. We have to really look at the policy. It is against HIPAA, and it's a violation to record a conversation in a healthcare type setting. So let's say you wanted to record a video um, or something of that manner, then you have to make sure that everybody signs off on a sheet of paper that that's okay to do. You cannot record anything without that client's approval. And HIPAA violations run pretty high as far as dollars. Again, looking at the psychosocial factors, impact on occupations. So you'll get a list like this. And this one I pulled is a little bit off. It's now Allie that you're very familiar with, and I'll make sure and update that for you. But all of us know Allie Cook's email. And things that we've got to do, we've already done, guys. We've done all of this. We've done written requests, of where you wanted to go, looking at your fieldwork manual site. All this is a check off that has been completed. Where we're looking at now is I'm still waiting on a couple of sites that will provide what's called an MOU, or memorandum of understanding, where they've agreed to, take you as a student and abide by what we want. We abide by what they want. And I've got a few out, and I'd rather give that to everybody at the same time. I've spoken with each and every one of your supervisors. I know whether they want to be emailed or text, but I'm still waiting on that official. We've got about 3 out now, so we're doing pretty well. As soon as that happens, I'm going to post that, and we'll post an assignment deadline where you have emailed your supervisor or text them as they require or would like about you coming, and about, what time to get there, what color scrubs do you need, and should you bring your lunch, where do you need to park, all the things you've been used to before. So, but at the end of the rotation, so we've done the midterm conference, the end of the rotation, I won't come back, to do the final. I'm only there for the midterm. Midterm, we should iron things out, and it's smooth sailing until the final. And so at that time, you'll see some forms you'll need to fill out. And so we'll make sure each week that you have that planning form done, which I'll show you where those are located. We want to make sure that we do something called the CEFWE. We're required to do it. It's your student evaluation of your fieldwork experience. There's a one sheet about the criteria. If you have time to fill out a feat, you're going to do that, because it only helps us in the future. So you are the ones taking care of yourself. You're grown, you've got this. You set up that time and say, hey, my midterm needs to be done this week. What works for you? My final evaluation needs to be done this week. What are your availability? And I'll let Miss Allison know. Also, Morgan helps a lot with those, and so you may see her at some of the midterms as well. She's doing them for a number of years. And then there's other things about applying for NBCOT and OTA state licensure, and that is a Miss Brandon question. So, this is the one sheet that I was telling you about. This is pretty much easy peasy filled out. This next one that we need to talk about is, does everybody pass? Answer is no. And we generally can start to tell that something's going downhill by that midterm. We will set a remediation plan at midterm if necessary. But what happens in that? A programmatic dismissal. And so it's failure to demonstrate, that you got a 91. And that's what your supervisor has deemed you as. If you have a score of less than three on items number one, two, and three, then that's safety, that's ethics. We have to be able to achieve that. Getting all your hours, failure to complete the course requirements. So what does that mean? That means you got to do the work in the course too. You can't just go to field work. It takes both. If it's applicable, you may have to do a clinical in-service, or you may have to do a like in pediatrics or geriatrics, they may want you to do a project. So whatever they require, it has to be done. We have to comply with the school and fieldwork sites rules and procedures. So I really take the time and review the handbook and make sure that you're aware of what you need to do. Unprofessional conduct, talking about other people, talking about clients, patients. It's happened several times where students have been out to eat after, their day of work at the clinical site. And next thing you know, they were actually sitting behind their supervisor as they talked about their day. So zip it up, keep it inside. You want to make sure that you don't do any unethical conduct, illegal conduct. You, you want this to be the best representation of yourself as possible. So, for whatever reason, let's say it doesn't happen, then if it's unsuccessful, then you'll get a note from me within a week with the final results. And then it's up to you to speak with the faculty, and you can request the review that we had done and looking at the materials that they've given us. And then we'll consider a repeat of the fieldwork experience. And so, what does that consist of? So, you'll contact us. We'll look at what happened and why it happened. And then, if you'll present your justification for it, and at that point, then reapply in order to be to the next um, rotation and be successful. Has it happened? Yes. Has it happened that they do that, a student does that, and they're able to complete a successful 8-week rotation immediately after? Yes. Have to find somebody that's able to take you during that time frame, and that we went through with a solid remediation plan that addresses whatever issues they had. If there are issues that they have that you also had all through school, then that's something we really got to talk about. And it's time to fix, because I know you want to graduate and we want to see you graduating as well. If it doesn't happen, or if you're not able to complete that, if approved in 16 months of completion, then you may be dismissed from the program. And so that's previous failed fieldwork experience, failure to comply with the school and fieldwork site rules, unprofessional, unethical, illegal conduct. If they drug test you and you're positive, I can't help you. Okay. So make sure that you're keeping everything on the up and up. You've got to show that the behavior is professional and it's not hindering your competence. Um, so anyone who withdraws or fails the fieldwork too, you're still responsible for the tuition. Has that happened? Yes. We've had people whose family, has been relocated due to the military and they're not able to finish. There's just lots of reasons that this could happen, but we are here to help you be the most successful that we can be. So that goes into the student initiated withdrawal. And so you'll let me know and Miss Brandon. And so we'll kind of follow those same steps we've just discussed. And if you know things are going to change, you still have that 16 months that you can come back and repeat that if it wasn't due to a failure. So problem resolution procedures, we will meet. I'm here. I'm fighting for you. Miss Brandon's fighting for you. Morgan's fighting for you. So if there's any problems, we're going to identify them, we're going to work on them, and we're going to get through it. But there are some behaviors that result in immediate removal. So violation of patients' rights, their confidentiality. Again, I cannot stress enough with HIPAA that you cannot perform any types of reporting based on those patient rights and confidentiality. If you falsify data, you go back and put in notes late, that's falsification of documents. Any illegal behavior act, possession of use or intoxicants or narcotics. Pretty much if you see it in the book, it's been done. So, any conduct that results in dismissal, failure to submit the drug test if they want you to do another one, anything you're doing to jeopardize the patient's safety. You have to keep health insurance during this time, and you have to still consent to that background check, drug alcohol screen, or release of information. There's things we got to do, guys. That's not the fun spot. So, what do you need to do? So, before and right now, I hope you guys are studying. You need to be studying all the motor milestones for pediatrics and activities, and then you want to for sure do the same thing with the adults. You want to look at all your diagnoses. When you are given clients by your supervisors, go home and study that diagnosis and what treatments are available. We have so many different opportunities now to look at, and not only the ones that Miss Brandon and we've discussed in class, but there's lots and lots of places for you to find ways in order to help your patient through activities and improving their functional deficits. So what's your responsibility? You do the AOTA standards. We're past the point. We're not going to substitute Fieldwork 1 for Fieldwork 2. We're not allowed to do that. You have to finish this in 16 months. We're all confirmed for where you're going, and so we can't change it now. But who can change it is the facility site should they lose their, um, you know, the therapist or the ability to take you. And so what do we agree? We're going to look at fieldwork files. We've done that. We're going to be on ACO standards and meet those prerequisites. We'll send off our letters in time. You will communicate to me. If you haven't heard back from your site, I need to know. I've had people before that'll come to me a week before they're supposed to be there and say, oh, well, I never heard from them. I need to know that way before that. I've already talked to them all, but in the scheme of life and the busyness of a clinic, they may forget about me. So let's make sure that we stay in constant communication as necessary. So we've talked about the 16 weeks, the 40-hour work week. Again, most places are 35 hours. Usually they'll work pediatrics will work long days, Monday through Thursday or Tuesday through Friday, just kind of depends. And then your rehabs and your nursing homes will generally do that 40 hours. But let me know if, I had a student one time walk in on a Friday and I said, what are you doing here? And she said, well, I'm off. I'm only working 20 hours a week. Well, we can't pass you at 20 hours a week. That's not enough for what we have to do. So please communicate with me. I don't want you to have to do more field work just through a miscommunication. What most of the stuff we'll do now is through email, or we will continue to use Ainsley if I need to get something quickly to you. There is the Facebook page, and I understand a lot of people don't check that as regularly. So, but please, if it's coming out through Ainsley, I need a response, guys. And there's been a lot of hanging where we don't get that. I don't get it. And so make sure if she sent something that came from me and I need to know. So you can always ask me. So please read through this. I'm not going to go through each one, but we've talked about what makes an effective student and what is challenging. And so sometimes if you're hearing some of these words from your supervisor, this is going to tell you what you can do to improve it. It's a nice little list that we have there. And then these are our resources. Now, you've already filled out all of these forms. I'm going to go through those kind of fast. Um, but I do want you, there's ethical practice, there's links that will help you. Um, the the guidelines for HIPAA, again, everything we've talked about there and how to keep that patient information private. Here is your big section on student resources. Please, please, please pay attention to this. And so we're going to pop all the way down here, almost to the bottom. We've done most of these on our other ones. But what we need to have is we've already done that. We've done this if you needed it. Um, we've done the effective skills. And let's pop on down. Um, that's one. It's one of these. Just want to make sure we see everything. Um, all of those have already been done on your other rotations. And so down here at the bottom, if I can get there, is a personal data sheet. I need you to send that to your fieldwork educator when I give you the emails. And so that's in a little different format. It doesn't, in this particular format of this manual, it's not formatted as great as I would like. But yours is. That's kind of that email that we did. There's a little budget in there if you need it to kind of figure things out. But this is your student weekly planning form, and you don't have to use this form. I have a few facilities that use a different one, and that's fine, but I need you to submit it every week, and there'll be a deadline by that. I think it's usually Saturday by midnight. So give me that short summary, sell yourself. Maybe your supervisor didn't recognize how wonderful you were that week. And then they'll put on what they want to see you, what they can brag on you about, or what they want you to do. And again, the format is missing some lines here, most likely just because it's adjusted. And so you're going to say what your goals are for the next week, and then you both sign it. When should you give that to your supervisor? Let's get it to them by Tuesday, Wednesday at the latest, so they have time to do it. We want to make everything easy for them. This particular form, weekly feedback, does not have to be filled out if they do the other one. Some people, some supervisors has requested this one. It's either or, it is not both. This is a very important form. So we've done the AOTA big form that's worth 124 points. On here, you're going to come up and say what your midterm score is. You're going to fill out this information. I want you on this side to say, what are your strengths? What do you need to improve on? When it says types of patient care experiences, what diagnoses are you seeing? And then do you have weekly objectives provided by the site, or do you not? Is it just decided each week? I need to know that. And then they're going to come through and kind of do the same thing, except they're going to grade us as far as your adequacy of your preparation for the rotation. And then this statement here is that I want them to look at that what you're doing is meaningful for the patient and that you're thinking about those psychosocial factors. So give me an example right here. Okay. The CEFLI is electronic, and you'll get that. It's a student evaluation, and it should be a check-off list now, but that's everything here, and it kind of tells you um, what we're looking for. That way, if somebody wants to know, oh my goodness, at Krista's kids, how many kids are they seeing? How old are they? How many did you have to see the whole time? And what were the diagnoses? Were they more severe? Were they less severe? Was everybody autism? So definitely very good information for us to have, and we appreciate that being done, but it also has to be done. So thank you for that. And then this is going to go through. Now, this is going to tell you about form stack and just in the last year they've changed it, and I will actually just email the form, but it is the same form, and that they're going to get as far as filling out what is important. And this is the information here. And they're going to grade you on that for a 1 through a 4. And so, again, if at midterm you can get all 2s on everything, whew, that's great. You get some 3s, wahoo. If you end up with a 4 out of 4 on everything, most likely somebody's just checking 4 out of 4 because last time I checked, I'm not perfect, and most of us are not. And so, but that's okay. That's how they feel, and I'll take that. But on the same flip side, don't take it to heart when you see somebody say, I got 124 out of 124. That doesn't mean you're not the same person as they are as far as being able to score something as that's what their supervisor did. But this tells you specifically. So if you're like, how can I improve my score? Well, do you know why you're doing what you're doing? What's the context? What's the theory? What's your frame of reference? Ooh, those are all terms from the past. So we might want to review those. Then here's their scale 1 through 4. This is the exact same thing that I had on the other page for you as well. So this is your book. I'm going to Let's see where my next thing is. Hopefully it'll pull up right here, and hopefully this will transfer. So if we look at our modules, and you will see that fieldwork manual's here. Here's your 2A PDF. There is an assignment here to give me your supervisor's fieldwork educator's name and credentials. Sometimes they switch it on me at the last minute, and I need to know that information. That's an assignment that has to be done pretty quickly. Here are all the discussion board assignments. Again, they're going to be due the week of that Saturday. So if you wait until Saturday, your friends are waiting on you too, because you got to respond to 2 of them. Get it done sooner. They're not hard questions. So let's say I click on week 2, and it says, what do I need to do to be better at my time management? What can I do away from field work that's going to help me? What's a light bulb moment? Where did things click? Okay. They're not hard, but I need them done. This last 2 things, you will look at your clinic where you're at and look and see, oh, look, that's evidence-based. Why did we do that research? So I want you to find an article that shows, hey, they're doing what has been, tried and true. And then the next one is this psychosocial factor. So when our last accreditation, she said, nobody ever does that right. Let's see what you're working with. And when she started looking at it from the accreditation team, she's like, this is great. So the assignment itself will steer us in that right direction. But you guys have done a really good job about that before. These are those planning forms right here, again, due by Saturday. And so if you click on those, it's the form that we looked at. There's that format where we can do those goals. So what are the goals for the next week? How did I do? How do they think I did? And we meet in the middle. Set that up your first week and say, what's a good week, day to talk about the week? Maybe Thursday, maybe not Friday at 4. They're ready to get out. Okay. Respect their time. They're taking their time to be with you. You'll see here that there's weeks 1 through 3. There's not a 4 because we're going to do your midterm summary sheet. That's that summary sheet. And then 5, 6, and 7, because week 8, you're done and we're doing the evaluation. So it's not as bad as it looks. These are those other forms that we've looked at as well, as far as your student eval, your midterm summary sheet, and you'll just submit a few things for me. So I have them electronically. And again, here are other forms. These have not been turned on yet, but they will. Final paperwork. And then I'll also just pull on a lot of the pediatric clinics see a lot of ASD. So we'll pull up this particular one. So you can have immediate reference to that. Some of them see kids who are more cerebral palsy, but we have seen that a lot are seeing a lot of autism. So That's it. I need you to review this video, and then I will have a form that you'll sign off by the end of the week on Friday and turn in saying that you have read this form. If you have any questions, please don't hesitate to let me know. And can't wait to see you soon. Bye.